Rabies is a completely 100% fatal disease. There is absolutely no cure.
Every 9 minutes, one person on Earth succumbs to the deadly grip of rabies, making it a ticking time bomb in our world. Rabies is also of great concern here in our communities, threatening lives, socio-economic development, and communal harmony. We joined our camera team on the ground in a Namibian village to assess the situation, capturing the reality of this silent threat. We've spoken to our Minister of Agriculture, Namibia's experts, and local residents to uncover the gravity of the situation.
The rabies elimination program that we do in cooperation with the Friedrich Loeffler Institute in Germany and our sister ministry, the Ministry of Health and Social Services, is an important program for us, and the reason is obvious. Rabies mediated by dogs is a disease that can be controlled and can be eliminated. It's a good target to try and do that as quickly as possible, because it not only affects human beings, it also affects domestic animals and wildlife. We also have a very tight and close relationship with the World Animal Health Organization.
Rabies is a notifiable disease in Namibia according to the Animal Health Act, Act number 1 of 2011. The Ministry of Agriculture, Water and Land Reform, in collaboration with the Ministry of Health and Social Services and the Veterinary Association of Namibia, developed a rabies control strategy in 2015. The objective of the control strategy is to eliminate dog-mediated human rabies in the country. The rabies project that we are implementing in the Northern Comuna area is supported by the German Federal Research Institute for Animal Health, or FLI, and also technically by the World Organization for Animal Health, WHA. And it has made significant impact with regard to the reduction of rabies cases in domestic animals and also dogs and cats, and also human cases. That was done through a One Health approach, so that we fight rabies in Namibia as a team.
The Directorate of Veterinary Services runs 2 campaigns as far as rabies is concerned. The first one is what we call a targeted campaign, which is basically targeting the vaccination of dogs as well as cats whenever they are brought with a crash pen. The whole idea is to get a coverage of 70% of these dogs to be vaccinated. Apart from that, we also have the annual vaccination campaign, as you have witnessed this morning, whereby it's a combination of vaccination involving livestock being vaccinated against lung sickness as well as foot and mouth disease, as well as now vaccinating dogs against rabies.
From 2006 to 2014, before the rabies control strategy was developed or implemented, the number of rabies outbreaks were over 400. The current cases that are reported are less than 10 cases per year. So that is something that is very significant, and this was achieved through mass dog vaccination campaign and also awareness, public awareness, especially at the schools. We collaborated with the Ministry of Education. We are educating the children at schools about the disease so that they can prevent themselves from contracting the disease and their families, because children are the most vulnerable to dog bites because of their love for dogs as their companion animals.
It's incredible to see the dedication of veterinarians, veterinary assistants, teachers, teaching assistants, community health workers in our fight against rabies.
If a child is bitten, or even an adult for that matter, there is need to immediately wash the wound with a lot of water and soap, and then after that, immediately come to the hospital. If it is ascertained that they need vaccination, then they will get a series of vaccines. If someone has never been vaccinated before, they get 4 vaccines on day 0, day 3, day 7, and day 14. It's very important to finish the course of the vaccinations, because if a person doesn't complete the whole course, they will not be protected, and the disease can still affect them.
The whole idea is to try eliminate dog-mediated rabies. By saying dog-mediated rabies, simply meaning the transmission of rabies virus from dogs or other related animals to humans. And this is actually a problem for Namibia. And the statistics shows that for almost every dog rabies case that happen, it either gets to a human or it gets to a livestock.
Try to avoid approaching strange dogs. Don't throw objects to the strange dogs. If the dog approaches you, try not to run away, and don't try to attack him back.
Central Veterinary Laboratory is an accredited laboratory under the accreditation body, the Southern African Development Community Accreditation Services, so of which the test which we perform, it is known as the rabies fluorescent antibody test. And this particular test method is an accredited method that falls within the scope of this accreditation body. So this means that our test is internationally recognized and well established. We also have a turnaround time of 24 hours. Therefore, after the test is completed, so within 24 hours, the result is then sent out to the referring veterinarian who submitted the sample, and then the result is communicated to the client. Rapid diagnosis is so important in control and prevention of this particular disease. And this could lead to saving many lives, both animals as well as human lives.
Imagine in Namibia where rabies is no longer a threat to our families and pets.
If you have a dog, if you have a cat, if you have any mammal as a pet, you have to take it to our clinic every year so you can get vaccinated.
It's a vision we can achieve through awareness and responsible pet ownership. Let's aim for rabies-free communities.